Welcome to the study session where we are breaking down the BCBA 6th edition test content outline. Today we are diving into task B14, Stimulus Generalization and Response Generalization.
Domain B, 14% of the exam. Generalization is one of the most clinically important topics in all of ABA. Behavior change that does not generalize is not meaningful behavior change. And the exam tests whether you understand both types, stimulus and response, and can tell them apart.
Let's define them clearly. Stimulus generalization occurs when a behavior that was reinforced in the presence of one stimulus also occurs in the presence of other similar stimuli. The behavior spreads across different antecedents.
Here is the analogy. A child learns to say hi when their teacher waves. Then they start saying hi when their parent waves, when a neighbor waves, when anyone waves. The response, saying hi, is now occurring across many different stimuli. That is stimulus generalization.
Response generalization is different. Response generalization occurs when reinforcement of one response increases the probability of other untrained but functionally similar responses. The stimulus stays the same but the response varies.
Here is where the exam will try to trip you up. Students flip these two constantly. Stimulus generalization, same response, different stimuli. Response generalization, same stimulus, different responses. Draw that matrix and memorize it. It shows up on the exam every time.
Let's do a clinical example for both. A child is taught to request break using a picture card. Stimulus generalization happens when the child starts requesting a break with different therapists, in different rooms, at home. Same response, new antecedents.
Response generalization happens when, after being taught to say break, the child also starts pointing to the door or holding up their hand when they want a break, without being taught those responses. Same antecedent, new forms of the response. Both are valuable clinically.
The verbal behavior connection is rich here. Generalization of man's across settings is a training goal. Generalization of tact responses to novel exemplars means the child truly understands the concept. Without generalization, verbal behavior skills stay stuck in the training environment.
And here is where ethics and the task list come in. G.15 requires you to design procedures to promote generalization. Planning for generalization is not optional, it is a required part of your behavior change plan. If you do not build it in from the start, it often does not happen.
Common strategies for promoting stimulus generalization include training across multiple exemplars, using sufficient exemplars, training loosely, and using natural maintaining contingencies. The goal is to make the training environment as similar to the natural environment as possible.
For response generalization, you can reinforce response variability, actually reinforce novel but functionally appropriate responses. Token economies and natural reinforcers tend to support response generalization better than contrived reinforcers because they exist in the natural environment.
The exam will also test generalization in the context of treatment planning. If a skill is only displayed during sessions with the BCBA, that is a generalization failure. It means stimulus control is too narrow. Your job is to systematically program for generalization across people, settings, and materials.
Resistance to generalization is a real clinical challenge with many learners on the autism spectrum. Highly specific stimulus control is a hallmark of the condition. Knowing how to assess and address generalization deficits is a core clinical competency, not just an exam topic.
Here is your summary. Stimulus generalization, one response, spreads to new stimuli. Response generalization, one stimulus, evokes new response forms. Both are desirable outcomes you must plan for. Both are tested on the exam with scenarios that require you to identify which type is occurring.
And remember, discrimination and generalization are always in tension. You want enough generalization that skills transfer to the real world, and enough discrimination that behavior only occurs in appropriate contexts. Balancing those two is the art and science of applied behavior analysis.
One more strategy worth knowing for the exam: train in the natural environment. If you only teach skills at a table in a therapy room, stimulus control stays narrow. Teaching in kitchens, playgrounds, classrooms, and community settings builds stimulus generalization into the training from day one rather than programming for it after the fact.
Indiscriminable contingencies also promote generalization. When the learner cannot tell whether they are being observed or whether reinforcement is available, behavior tends to occur more consistently across settings. Thinning to variable schedules of reinforcement during generalization training is one practical way to accomplish this.
And do not overlook the role of self-management in generalization. Teaching learners to monitor their own behavior, set goals, and self-reinforce extends behavior change into settings where the therapist is not present. That is the ultimate generalization outcome, behavior that occurs independently in the natural environment.
Functional reinforcers also support generalization better than arbitrary ones. If the reinforcer in training is the same one that maintains the behavior in the real world, praise from peers, access to preferred items, the behavior is more likely to persist and generalize. Build your reinforcement systems around what naturally exists in the client's life.
For more practice questions, visit www.bcbamockexam.com.
See ya.
Bye.